he raised a very important point about saying that you don't need the rock star doctor, you need a team where each one does their bit. Okay? Now, how do you see, you are developing tech solutions for training doctors, nurses, etc. How do you see the community health worker who is on the front line being trained adequately to use tech and supported by tech on the back end? Some of the things he talked about, right, would have been part of, say, a checklist. Things that can do that knowledge transfer and help in task shifting. What are your thoughts?
Let me start with a small anecdote which happened years ago. My first time I went to US in 1998 to Rochester, where IBM's site was there. And then we drove down to a place called Little Rock, Arkansas, from where Clinton came. Clinton was in the 5th year of his presidency. And very colorful guy. During that period of time, his escapades were in the news at that time. So I wanted to see where is that place where this kind of a character comes out from. One of the things I observed was Little Rock does not have a primary health center. The place where you have to go if you're a resident of Little Rock is 27 miles to approach first primary health center. 27 miles from a city of around, a place of around 700 families staying. 27 miles. So I came back to India. By the time we had 3 or 4 major clients, even Karishma. And I came back and said, how come primary health center is not given importance there also? One of the problems in India is that we pay very poorly people at the primary level. Wherever it is, it doesn't make a difference which industry, which sector, anything. We pay our drivers, our clerks, our office boys, our peons, our nurses, pathetic amount. One thing which is now changing is that this government is actually enhancing those who run CHOs in the wellness center, where the salaries are about 38,000, 40,000, which is almost double the salary of what is a normal nurse gets in a hospital. So things are going to get better because better people will come to run. That's one. Second thing which we always work is that technology is always an enabler. See, you find a CT scan which is full of technology. A doctor will take it like this. Give him a EMR, he will not bother about it. I think I and Dr. Evita struggled for 2.5 years to get the basic gynec obstetric EMR at Fernandez in 1999-2000, if I'm not wrong, around that period. We couldn't succeed. We couldn't succeed with EMR in care. We couldn't succeed with anything till 2007. So the basic problem is technology is not going to help if it comes on the face. Second, doctors are the worst kind of people who discard technology if it comes from anything other than US or UK or whatever it is. No. Well, my friends go to him for treatment, so I have to be very careful. So, technology is, doctors use the technology, but they don't also allow the technology to come and tell them something, make them feel better. We have struggled. We have struggled for 15 years till I sold my company off in 2010. I never made money in India. I always lost money in every project of India. The money that I made was outside India. And when I say I did not make money, I lost money by huge margins. So, we don't give respect to people who do basic work. Unless that comes in, things will not improve. That's my first thing. Second thing which I believe is that we celebrate, as I said, we celebrate a lot of things. We celebrate Sachin Tendulkar or Virat Kohli. We never celebrate Ravindra Jadeja. We never celebrate somebody else who does the full work in the system. That's where the problem starts. And all doctors also follow the same thing. You go to a care, till Dr. Subbarao was there, he was the star. There will be 4 more Rajus and 4 more others who were the star. All other doctors were unknown figures. So unless we start celebrating them, we are going to have problems. And third point, which I think is much more, things will improve because number of doctors are getting more now. The numbers started increasing from 2015 to 2017. By 22 or 2027, we will have 100,000 doctors passing out every year. Out of that, I believe that 65,000 doctors will become MD, MS and all those things. But remaining 35,000 will be forced to work as GPs. I think that's where the things will start becoming better. I believe that technology will help. But then to get technology, you need to pay money. And technology is the last thing that a hospital determines. After everything is over, the budget is here, we have 2.5 lakh rupees, can you do the software? Or we have, he would not mind, I remember a hospital in Pune, very well-known orthopedic hospital. His Toyota Corolla car had a better garage than the server of IBM in this hospital. Believe me, actually I'm telling you this. His Toyota Corolla car had a better garage, much better than my server room which he had given to us. And when I actually showed it to him, he changed it. But then, that's the level that you, like this I'm talking about in 2003, 2004.
But I want to pause you on that. Right? I mean, we have challenges in implementation of technology. However, we're also saying that unless you move towards increased use of automation and applying, industrial concepts, that you can't increase efficiency, and therefore the ability to bring down costs is going to be challenged. I want to try and get thoughts from you and then from Dr. Narasimhan about how can we do this. See, today, for instance, you take telecom. Okay, when we started out, an incoming call used to be $8, an outgoing call was $16. Today, it's down to a few paise. Okay, can we try and get somewhere close to that in, say, a healthcare setting? Today, for instance, one of the questions I kept getting asked all the time is Ayushman Bharat sets rates which seem impossible. So hospitals come and trip saying, how can I do a C-section for 12,000 rupees? And perhaps there is a way to do a C-section for 12,000 rupees. Do you see technology helping to do that?
One of the problems with technology is that when people start looking at it, they have fancy ideas. I remember I called up Dr. Ravindranath, who used to run Global Hospital in those days. I said, have a look at my friend. He says, boss, Guru, we have a problem. I have to charge him more. I said, what happened? He has got 200 pages downloaded from internet. And he's comparing the surgical processes with US statistics and saying, is this good or that is good? So I need to charge him. Our general knowledgeable community has got this fanciful ideas about what you can get from internet. Okay? And this is going to be a challenge for anybody today. So technology per se has to take care of your administrative work first. Second is that technology is also helping, you cannot replicate care in technology. That's one challenge. Every single individual patient is different in nature. So you can, to a basic level, take care of it. After that, you cannot. So technology will take you to that level where you can train them, you can get resources, you can get statistics, you can get evidence, you can do all this, but it's not going to help treat patients. Treating has to be done by doctors, nurses, and the middle level people who run the hospital, technologists and stuff of that kind. Unless you focus on them, things are not going to. And you can do what you want. 2007-8, I did home care. I and Giri put together, we ran home care, tried, tested, working everywhere.
We didn't get a single client. The first client we got was in 2021, after COVID. And we had everything that was being done in 2021 available in 2006-07. So technology is not going to help you. Technology might increase your reach, technology might do this, technology might do that. End of the day, you have to get better people to serve, better focus. Don't get into the star business. Virat Kohli is good, but then the guys who win you tournaments and others are guys who are unsung. Look at them.